and welcome to another episode of the STEM Girls Talk Show. This week, we would be taking a deep dive into the world of medical science, for which we have with us an amazing young doctor who has made it her life aim to help out young girls and people. So, interviewing her, we have two lovely young hosts who would be asking her a series of questions regarding medical science. I am first will ask the doctor to please give us a short introduction about herself and her grad work before we get into the question and answer session. Thank you, doctor.
Okay. Hello, everyone. I am Dr. Nosawema Harriet Ibadhin. I am a medical doctor. I have always shown interest in women and children, in helping out women and children, because of when I was in secondary school, I was a member, in fact, primary and secondary school, I was a member of the Girl Guide Association of Nigeria. And so we used to carry out community work, outreaches and all. And um, the association, when I stay in the university and all, I was very determined to achieve my life goals. I'm married. I have a little baby. He's 2 months old. So I currently work at Edu Specialist Hospital. I I function as a what do you call a house officer. So I'm kind of not a specialist yet. So I'm doing everything as part of my training, and hopefully in the next couple of years I'll begin my residency. I hope to specialize in obstetrics and gynecology that deals with basically the woman's body with pregnancy and without pregnancy. So I guess that's
Thank you
a
so much.
little information about me. I'm from Edo State, Nigeria. I currently still live in Edo State, Nigeria.
Thank
Yeah,
you.
thank you.
Thank you so much. So, Favour, what do you want to ask doctor today?
Could you briefly describe your work and area of specialty?
Okay, so like I explained earlier, I am currently have all the areas of medicine that are non-surgical, that don't involve surgery. And then you have the surgery. So it's a 1 year training which all medical graduates have to undergo after medical school. That's what I'm currently doing. And so I'm basically a jack of all trades at this point. I'm doing everything. So and after I've got a taste of all the core specialties, I'll get to then settle down for a specialty. So right now I'm not a specialist. I'm just doing the general. I'm doing everything. Yeah.
Thank you. What are common features you see in someone who was injured due to domestic violence, and what area in medical specialty can help them recover? Did you hear me?
Yes, I did there. Thank you very much for that question. Okay, so the common features that your question is common features you see in a person who is a victim of domestic violence and which specialty will help them. So, first of all, for someone who is a victim of domestic violence, on presentation to a hospital, um, most likely the first point of call will be probably the emergency room. That's if the person was not referred to a particular doctor. The person just walks into the hospital and will most likely be seen at the emergency room. So at the emergency room, you have the medical emergency, you have the surgical emergency. So on presentation, you have what is called triage. So the person will be seen by a general, an emergency room doctor. and you have paramedics, you have nurses who will evaluate that, who will look at the patient and see where, if the patient is a surgical patient or a medical patient. So basically, when the patient comes, the first thing you do is you inspect. The first thing the doctor does is to inspect, observes the patient from head to toe. First, from the gait, from the way the patient is walking. Probably the patient is walking in, is limping, looks obviously hurt. Maybe they can't walk properly. So you've observed that, like, okay, this patient can't really walk. Then the mood of the affect of the patient. That's the way the patient appears. It may look like the patient is down, like sad. Patient may appear um, in pain. Patient may appear afraid. So, okay, those are things that we're looking out for. Okay, this patient, cause let's assume is a woman. She can't, a young girl rather. She can't walk well. She's limping. She looks afraid. She looks scared. Then okay, we offer her a couch to sit on or to lie on. Ask her things. How are you? What brings you here? What happened to you and all? And she um appears reluctant to give out information. Then so that's for the first part of just inspecting the overall look of the patient. So then specifically to wherever the injury may be. So the injuries that commonly present from violence are um some kind of injuries like broken bones. And most times the stories you hear, because most times victims of violence don't exactly want to give out the information, they don't want to say what exactly happened to them. So you find let's assume the same young lady came in with a broken arm, and like, oh, so you have I can see that there's an obvious fracture here. So what happened? And they tell you something like, oh, I was just walking and I fell. And you're like, okay, a young girl like this, you just fell, and next thing your arm, your bone is getting broken. It's not possible. So the stories that they tell you usually don't tally with the injury. So in that kind of situation, we will not have to pry further, understand, to get out what really happened. So those are things that we're looking out for. So their stories are not really tallying with the injuries. Then things like burns too. You can see maybe the shape of a pressing iron burn on the person's body, or cigarette butt burn on the skin. And things like for example, a child now coming with a black eye that's bruising around the eyes, and like a child, children when they fight, and they can't, they don't have enough strength to inflict such injuries on each other. So when you see a child with a black eye, it was most likely inflicted on by a stronger person. So that's already pointing to abuse. Then okay, so that's for a child. So back to a young girl. You may see things like her clothes may appear torn, looking like she was obviously harassed. So okay, her clothes are torn. Then so different. There are just so many things that could happen, because there are so many types, so many kinds of injuries that. And so the basic thing is being able to recognize them based on the appearance of the patient and what we call the history. That's the story behind the injury. When you ask for it, what they tell you or what you're hearing may not really tally with the actual with the injury. I don't know if I've answered your question here.
Yes,
Okay,
you
so
have
back to you
answered
said
my
it's
question.
yeah. So you said the specialty that
Thank you.
handles them. So if it's a child, it will be so the emergency room doctors will now refer the patient to a particular doctor. So if it's a child, the patient to be taken to a pediatrician. And so, but if he's a child that's under the age of 18 in Nigeria, but if he's an adult over 18, if it's like a fracture, involves has a fractured bone or something, it will have to be handled by the orthopedic surgeon. If he has a head injury, to be handled by a neurosurgeon. If there's no if there's any kind of injury at all, it has to be handled by the surgical team. It could be the trauma surgeon. But if it's a medical thing, something that drugs can just handle, it's handled by the physicians. Yeah.
Thank you. Thank you.
Thank you.
Favour, what's your next question?
What are the challenges and prospects of being a medical doctor?
Okay. Challenges first. The challenges of being a medical doctor. So based on practicing in Nigeria, using Nigeria as my because this is where I am right now. Being a medical doctor in Nigeria isn't really easy because it is very tasking emotionally and physically. It takes a lot of your strength, your mental strength, your physical strength, because sometimes you have very long hours. You have to be working. You see a lot of patients. Sometimes you're going to be on night duties for like 3 days straight. We call it calls because it's not like you're coming to work only at night. You actually work in the daytime, then you stay back and you end up sleeping in the hospital, and sometimes for multiple days. So then you have the psychological part of it. Your mental health may be affected because you see a lot of things. You get to witness deaths. Sometimes you get emotionally attached to a patient, or you see a young child and you really want to help this child. You're doing the best you can, and the child doesn't make it, and you feel so bad. You go home, you're down, and all that. There's that part. Then you are working so hard, yet the pay in Nigeria isn't so much. So you find yourself not being able to just meet all the needs of your family just by your salary alone. You may not have to add an additional source of income, and that too makes you quite busy. You're always working, so you hardly have time for anything other than work. So those are the disadvantages. Another thing is in Nigeria, doctors are seen as wealthy people. They earn big, whereas that's not really the case. So you find yourself being a target for for all sorts of things like robberies and stuff. So those are really the major challenges. Especially the work hours. The work hours are crazy. You end up working. Sometimes you go a whole day, you've not even eaten, and you don't even realize it to the end of the day. You're like, wow, I haven't eaten today. So those are the challenges. The advantages, the prospects, that it's something that keeps your brain sharp because you're always reading. You have to read, you have to learn new things. As any new thing comes up in the medical profession, you have to know it. If it's a new drug, if it's a new way of handling a particular disease, new way of doing something, you have to learn it. So you're always up to date. It helps you to think on. If they bring in a patient, you are thinking of so many things. Okay, this looks like this. To diagnose disease is not just for any laid back person. You have to be a very smart and someone who is able to think on your feet. Another thing is that in the medical profession, you find yourself being able to work with. You find yourself being able to work with any kind of with all kinds of people because you've dealt with harsher environments. Then also, in a way, once you've been a professional, being a being one of the professional jobs in Nigeria. It puts you above your fellow graduate, because when you finish medical school, getting a job may not be as difficult. Although it's not so easy, though it's not so easy, but at least it's not as difficult as your counterparts. Because in Nigeria, the unemployment situation can be very bad. People graduate and for years they don't have a job. But as a medical doctor, even if you are not able to get where you can get in your residency slot and all, but you can always work in a private hospital or something. So the job availability isn't as bad as the other professions. Then another thing is the job satisfaction. When you help people, like, okay, they brought in someone who was unconscious, you're able to diagnose the person, like, oh, this person is suffering from this, probably low blood sugar. Like, oh, you're able to recognize it. Somebody's unconscious, and you recognize that, oh, it's low blood sugar, and you're able to quickly correct it. You correct it, and the person who was unconscious is suddenly awake. So that whole satisfaction of, oh, I just saved somebody. If I didn't recognize this and administer this drug, this person could have died. But I recognized it, and I was able to save this person. So that whole satisfaction is something that's it's fulfilling.
And I don't think that
It makes your
satisfaction.
career enjoyable.
Yeah, I don't think anyone can get that satisfaction from anywhere else. The satisfaction of saving another person's
Yes.
life. That's why we respect doctors so much. Favour, I think that answers your question
Yes.
very well. What's your next question?
Thank you for that delightful answer. My next question is, I aspire to be a gynecologist. Could you please advise me on how to achieve my aspiration?
Oh, that's nice. You aspire to be a gynecologist. That's beautiful. So,
Yes, thank you.
so gynecology is, I'm sure you know what it is already, the specialty that deals with women. So it's usually paired with obstetrics and gynecology. The obstetrics deals with the woman who is pregnant, so takes care of the mother and the unborn baby. So everything that has to do with pregnancy and everything. Once she's pregnant, delivery is handled by the obstetrics unit. Then the gynecology deals with the woman's body outside pregnancy. So any issue that the woman will have with her reproductive organs and all, she will see a gynecologist. So in Nigeria and in most places in the world, the first step is to go to medical school. Medical school means that you go through all the specialties in medicine. You will go around from psychiatry, internal medicine, public health, everything. You go around surgery. So after you're done with medical school, you do a 1 year training where you go to the core parts of medicine, which include the internal medicine, like I said, gynecology, pediatrics, and surgery. After going through those 4 core parts, so for just Nigeria only, you do the youth service. And in the youth service, after that youth service, you now apply for residency. So that is where you now get to choose obstetrics and gynecology. That's how you get to be a gynecologist. So the gynecology in Nigeria is about 6 years, 6 years residency. After that, you are a specialist, you are a gynecologist.
Wow, thank you. That was my last question. Excel, please.
My question for you is, what is a cadaver and what are its relevance in medical practice?
Okay, thank you for your question. A cadaver is actually a human body, so a dead human that was preserved in a chemical known as formalin. So the body is preserved in a chemical known as formalin and used for scientific purposes. So in this, in medical field, it is used it's used to study the human body, study the anatomy, the parts, the different parts of the human body. So in the early part of medical school, I think the second year, you start using the cadaver to understand the human anatomy. So you get to cut it open, look at the various organs. So it's not just seeing it in the books. You go to the cadaver, open the organs, bring it out, and study it very well. So you actually get used to the way the body is structured by studying the cadavers. So that when you get to the clinical part of your medical training, where you actually go to the hospital and you get to see live humans. So by then you totally understand the human body. That when you see an actual living person, you understand every part of the body and you know what to do. So the cadaver is for medical training. Is to study. It's actually human body that has been the dead human body that has been preserved with a chemical known as formalin and is used for scientific purposes.
I had no idea. That was very good information. Thank you. Excel, what's your next question?
Thank you, Ma.
Welcome.
You unmute
My
again.
next question is what is the difference between blood group and genotype, and why is it necessary to know your blood group and genotype?
Okay. Okay, so let's start with the blood group. The blood group is a method of describing the various characteristics of our red blood cells. I don't know if you know what the red blood cells are. They are cells in the blood that actually give the blood its red color. So, and they carry oxygen around the blood. So these are the this blood group is they are different is a way of classifying the type of the characteristic that the cells carry. So you have the ABO blood group, you have the rhesus blood group, you have various methods of classifying it. So the ABO and the rhesus are the common types. So the ABO blood group, um, that's the A. You have the blood group A, blood group B, blood group AB, and blood group O. So this type of blood groups, the A and the B and the AB and the O just tells you what is known as the antigen. That's what what the cell actually carries, known as the antigen. So if a person has the blood group A, he will have antibodies to blood group B. And so that means that if the person receives blood from somebody that is blood group B, those antibodies are like soldiers. So since the person is blood group A with the antibodies or soldiers, these blood group soldiers against B, if the person receives blood from blood group B, those soldiers will fight. Those antibodies will fight the blood, the B blood, and kill the cells. I don't know if you're understanding what I'm trying to explain, but the importance is that for transfusion, that's when someone has lost a lot of blood or the person doesn't have enough blood and person needs a blood transfusion. You have to know the blood group because giving the wrong blood group, like I explained, someone with blood group A, person already has those antibodies, those soldiers B against B. So you have to give the person only blood group A. so that the person's body can accept it. So if you give blood group B, those antibodies will fight that blood, and there'll be a very, very bad reaction and can even kill the person. So it's very, very important in things like transfusion. Then you have what they call the resus blood groups, another characteristic that the cells carry. So this resus blood group, it could be positive or it could be negative. It's also important because of things like transfusion. Because someone who is resus positive, it means the person has that characteristic, that trait, that resus blood group. So if, for example, now a person needs blood, and you now give, for example, if the person is resus negative, that means doesn't have that characteristic. But being negative, he may have those antibodies, those let me not go too deep since so that you can understand. But basically, you have to know the characteristic of the person's blood in order to know blood that is safe, in order to find a donor blood for things like transfusion. So if somebody needs blood transfusion, the person's blood group has to be known. So genotype is another characteristic entirely. Genotype actually deals with what is inside, not what the cell is carrying now, but what is inside the cell, and the arrangement of the protein known as hemoglobin. So the red blood cells I talked about that give the blood this red color, and they carry oxygen. So what actually helps them carry oxygen around the blood is the hemoglobin. So the genotype is actually telling us the characteristic of the hemoglobin. So you have the AA, you have the AA, you have the AS, the AC, you have SS, you have SC. So all these are just variations telling us the type of hemoglobin that the person is carrying. So it's important because you have some conditions that are associated with some particular types of genotypes, such as the SS and the SC. The AS is carrying an S chromosome, or rather an S. The hemoglobin of someone who is AS has that S, which means that if the person gets married to another person who is also AS, they have a chance of having a child who has the SS genotype. And that SS means the person will have the disease known as sickle cell anemia. So that's why it has now become a thing that we're talking about, blood group genotype. Blood group because of, for transfusion purposes, if the person needs blood now, you need to know the blood group. Genotype because we want to know which people are actually compatible to get married, because we don't want to be having children that are SS genotype, meaning that they will have sickle cell anemia, and it's a very bad disease that people suffer from. So it's something that we talk about now. It's something that everybody needs to know. So the genotype is what is the characteristic of that hemoglobin that carries oxygen. While the blood group is talking about the cells in general, a particular trait that they carry known as the antigen, blood group antigen. I don't know if I've tried to explain it to the
I think
best of my ability. I don't know.
You explained it very well, to be very honest. That was very nice. That was
Thank
a
you,
lot.
ma'am, for your answer.
Excel,
You're welcome.
I think we are running sort of short of time, so I'm going to skip to the next question myself so that we can wrap this up. So, Doctor, I'm just going to ask you two more questions. One is what Excel had to ask, which are what are the qualities of a good doctor? And then I'll ask the last one later. So
Okay, qualities of a good doctor. Um, First of all, a good doctor has to be very observant because we are taught in medical school that the first step in treating a patient is to, first of all, recognize what is wrong. And how do you recognize what is wrong? You don't rely totally on what the patient tells you. Because someone might just be walking, I may not even know that he or she is sick. So for you have to be able to diagnose a disease, to be able to know. So how can you diagnose a disease? You have to be observant. So right from when the patient walks into the hospital, walks into your office, walks into your consulting room, you are observing the gaits, the way the person is walking. You're observing the general appearance of the patient. The patient sits down. Okay, you observe how did this person sit? Did this sit like someone that was in pain? The person sits down, starts talking to you. Oh, how is this person talking to me? How is this speech? Is it flowing properly? Is this person talking like he knows what he's saying, or he's having a loss of words, or he can't seem to complete his sentences? How is his speech? Is his speech slurred? So things like that, even the minutest detail, you have to note it. Then, so that's one. You have to be observant. Two, you have to you have to be um you have to be able to tie in all the information you get. So first after observing the patient now gives you the history. You take the history from the patient. Oh, this is what happened. I've been feeling this pain here. Okay, the person has told you the pain. You have characterized the pain. You know where the pain is. You know the type of pain. You know when it's starting. You know everything about that pain that the person is feeling. You know everything the person has done to treat it so far, and how far the person has come. You know everything. So how do you now, okay, fine. After listening to the patient, you now examine the patient. You touch the place that is supposedly painful. You touch it. You examine everything. So after that, how are you able to tie in what the person told you and what you observed together, and make a clinical diagnosis? Because it's when you now suspect something that, oh, it could be this, this, or this. You now give out investigations. Okay, I need you to do this test. So you now do the test. You get the results. Oh, it now confirms your diagnosis. But you first have to have a suspicion, because if someone just comes in with a certain pain and everything, and you are not able to um you don't have any suspicion at all, you are completely lost, it's not a good sign. So that's another thing. You should be able to tie in all what you have gathered from that patient, from the history, from the examination. And if there are now test results, from what the test results are saying, you should be able to tie them together and give a diagnosis. So you should be able to make a diagnosis. That's two. Three, you should be up to date. You should be up to date. You, if for example now, a disease like malaria that is endemic in Nigeria, the treatment has varied over the years, from the days of chloroquine to the days of fancida to now the days of those what we call the ACTs. That's what is used to treat malaria now. So you have to be up to date. So the fact that, oh, you're aware that in those days chloroquine was used to treat malaria, you just decide to stick with it, even if now that it's resistant to chloroquine, you decide that it's chloroquine you want to keep giving. So no, you have to be up to date. You have to know the new trends, the evidence-based practices that are now being done. So that's that. You have to be up to date. You have to be patient. That's why your patients actually call patients. To remind you that you have to be patient with them.
True.
Some people will not just divulge their problems immediately. Sometimes it will take a while before you are able to get out everything you need to get from the person. Or it may just be that you are in a field like psychiatry, where the problem the patients have are mental. They're in their mind, problems of the mind, not physical. that means you have to be listening. You have to be a listening ear for them. Or it may just be that the patient has suffered some sort of traumatic thing and just needs somebody to talk to other than their family, or so besides their own physical problems here, they may just want to talk to you. So you should be patient enough to listen. You should be kind. You should be kind. You have to be kind to them because some people are in great pain.
You, you sound like a superhuman, to be honest.
Hello.
Hello, sorry about that. You make doctors sound like superhumans, and I'm sure they are. And because all the qualities you've so far listed, I can only imagine a superhuman having them. So I'm going to ask you on our closing remarks. That, by the way, thank you so much. This was amazing. So much information and that you've given so far. My question would you be to, as a doctor, and that too in Nigeria, right? Because
Yeah.
we've talked to a lot of professions. We've talked to engineers. We've talked to physicists, mathematics, all women, and they have had difficulties being women in their fields of STEM, right? So my question is in 2 points. Number one, do you think you have specific challenge as a woman in a woman doctor in Nigeria in STEM particularly? And my second part of the question would be, what advice do you have for young girls in general who are aspiring to take up medical sciences and, look towards that journey?
Okay. The challenges I face are one, balancing work with family life, being a wife and a mother. It hasn't been so easy because of the crazy hours at work, but it's um it's something that you can't say because, oh, you're a woman, you can't go into it because it's maybe a male dominated field, or it's that, it's too stressful. If it's something you love, you should go for it, and people have done it in the past. You most likely will not be the first. People have done it, people have succeeded, and you can succeed. So that has been my driving force. So the main challenge I faced is actually that, being able to combine it. It's actually time consuming. It's a time consuming job, and it takes my time, it takes my energy. But I've been able to achieve some kind of balance. So that's the major challenge I've faced. Then, okay, my advice for girls who want to go into the medical field: you have to be focused. You have to be focused because it's one thing that I remember in medical school then, the girls were always the top, among the top 10. Like if you have the test results come out, you see 6, 7 out of the 10 highest scores would be girls. And it's not like we're more girls. In a class of 100, in that was when we started, in a class of 100, we were just 20 girls. And I would put it to you that 20 girls graduated at without failing. We scaled through all the levels without failing, without failing out, without having to repeat, without leaving, dropping out of the class, nothing. But for the 80 boys, only in the end, they were just out of the 80 boys, they were, I think, half of them, about 40, that eventually graduated. Yeah, about 40 of them, so half of them. But the girls, because of our determination, knowing that, okay, this is medicine. Most times when you are even in the hospital with your ward coat, people see you and the first thing they say is nurse. And nurse, excuse me, nurse. And you have to tell them, oh no, I'm not a nurse, I'm a doctor. Because when they see a woman, they expect you, okay, no, you shouldn't be a doctor, you cannot be a nurse, a paramedic. It's not that those courses are not good, they are also very exceptional courses. But you should be able to do whatever you want. If it's a doctor you want to be, you should be a doctor. Nobody should tell you that, oh, you should go for another thing that is more feminine in their own eyes. So that's that. Be very focused. Myself, my classmates were all very focused in school. And I remember when I graduated, I came out as the best in obstetrics and gynecology, best in community health, best in mental health. I had a distinction in mental health, and I was also, yeah. So like the distinctions and even the best in surgery was a girl. And when they called her out that day, everybody was like, "Wow, a girl." So even if the girls were fewer in number, but yet we're more focused. And even our lecturers, they always said it. They're like, in medical school, the girls are more focused than the guys. The girls are more focused than the guys. And even when you go around in your different postings, when they take you around your rotations in the hospital, when they look at you, because they will share you into groups. In each group, maybe you just have only one girl to like 5 boys. And some groups you don't have any girl at all. The groups without girls, you find out that some of them won't even come to school at all. So, but the groups that you have a girl, the girl will automatically be the group leader, and because of that, she will encourage her group mates to come. So it's a very, very beautiful profession. It's a very, very interesting one. It's so diverse. You can be so many. You can finish and decide, oh, I want to specialize in family medicine. Family medicine is not as stressful as some other. You can finish like I want to be a plastic surgeon, and go ahead and be a plastic. You have female plastic surgeons, though few, but they're still emerging. So be focused, and you can do it. Read. You have to read. Like when I was going into medicine, they told me you have to read. I just thought, oh, they were just man. When I saw the work, you have to read, and you can do it. They will scare you. Oh, this exam is so hard. It's so this. Just read consistently every day. Even if it's just 1 hour, you read. You will get there. So be focused, be determined, work hard. I know this seem to be general, but it's the truth. You keep hearing it
Yeah.
because it's the truth.
That is true. And I think that among all the professionals we've talked to, we've heard the same lines that if you're determined,
Yes.
there's nothing that can stop you, and that girls are more focused. That makes me so proud that we are more focused in almost every field. Thank you so much. This was a pleasure talking to you. It was amazing talking to you. Thank you, Excel,
Oh,
for
I'm
your
so
time.
honored.
This
Yeah, thank
is
you.
one of my favorite sessions as well. I wish you and your son the best of luck, and thank you for joining us today.